Hello, Marina. Hello. Hello, Dr. Marina. Can you hear me?
Hi, yes, I'm so sorry, I was silenced.
Oh, okay. Yeah, so yeah, we can see you. Would you want to share your slides?
Yes, I'm gonna try and see if this works. Bear with me just one moment that I put them in full screen, see if they load properly right away.
Already replied last week.
Very good afternoon to everybody who's here. I think I should be. So, a very good afternoon. I would like to request all the dignitaries to please come here up to the dais. Yeah. So once again, a very good afternoon and a warm welcome to the official launch of the policy brief for India 2021. Just to introduce myself, I am Dr. Tanika Lingdo and I will be anchoring this event for today. It is indeed a very proud moment for all of us here to witness the launch of the policy brief for India, where ICMR has partnered with Lancet Global Countdown. So on behalf of the entire ICMR team, I warmly welcome all the dignitaries, scientists, researchers, and colleagues who are present here, as well as those who have joined us virtually from across India and globally. So without any further ado, let us start the program for today. I would like to request Dr. R.S. Dhaliwal, Head Division of Non-Communicable Diseases, to kindly deliver the welcome address. Dr. Dhaliwal, as we all know, is the nodal person for initiatives around environmental health and climate change at ICMR. So, sir, may I request you to kindly give us the welcome address.
Good morning, everybody, and welcome to this launch of the policy brief for India, which is part of the Lancet Countdown on Health and Climate Change. Climate change, as we all know, is a multifaceted, multifactorial, multi-institutional entity, both for its causation as well as for its remediation. It cuts across various ministries, both as the cause as well as the remedial measures which need to be taken. But as the health personnel or the health ministry, we are the one who feel the brunt of it, as we have to tackle the final outcomes or final effects of the climate change on most of the populations, be it diseases, be it nutritional deficiencies, be it waterborne diseases. So all of these ultimately come as a burden at the doorstep of the health department, which has to manage and tackle and take care of the problems of the population. Recognizing this need, ICMR has long ago initiated a major project on climate change, which was around more than a decade now, which is ongoing at the ICMR headquarters. And we also have a Center for Climate Change, which is established in the National Institute of Malaria Research in Dwarka. So these are the two major initiatives which ICMR has already taken. And the most commonest effect of the climate change is primarily vector-borne diseases, which is the most easily discernible, the first discernible effect of climate change as a result of the temperature change, which is maybe just around 0.5 or 1 degree. But that small difference also makes a lot of difference to the vector density at the particular sites, especially in the sub-Himalayan regions. And our task force did demonstrate that the areas where malaria was never found, now we are seeing malaria cases in those areas. And subsequently, we have expanded it to study the visceral leishmaniasis, which is another vector-borne disease in those areas, as well as the vulnerability assessment and the adaptive measures which the country can take and which the organisms take in those areas to combat the effects of climate change. Most of the effects of climate change do occur as part of the communicable diseases, but the climate change process is not in that sense a communicable disease or in that arena. And most of the effects what we see of climate change is because of either flooding which will lead to a lot of waterborne diseases. Even temperature changes, in addition to the vector changes, also affects the waterborne diseases like cholera outbreaks are become much more common with a slight change in the temperature. So these are the problems which the country is also grappling. And air pollution is another major factor which, even though not directly a part of climate change, but does contribute a lot to the climate change in form of the fine carbon particles which are released into the air, the PM 2.5, and the stubble burning, which is a short-term cause, but the carbon which is thrown into the air does have long-term effects, as it also contributes to the rising of the global temperature across the world. So considering all these issues, I think it is very opportune that this policy brief has been prepared by the team from ICMR, and we have the authors, the reviewers, as well as the expert panel member of this policy brief to disseminate the findings of this policy paper. So, thank you.
Thank you, sir, for the warm welcome. Now I would request Professor Dr. Balram Bhargav, Secretary, Department of Health Research, Ministry of Health and Family Welfare, and the Director General of ICMR, to do the honor of launching this policy brief for India 2021. Professor Bhargav requires no introduction, as we all know. He is globally recognized scientist who has taken ICMR to newer heights, in particular during the COVID-19 pandemic. Sir, I would request you to kindly release the policy brief. Thank you, sir, for releasing the policy brief. Now I would request you to kindly deliver the introductory remarks.
Thank you, Tanika. At the outset, I would like to congratulate ICMR. I would like to congratulate Lancet for bringing out this policy brief for India 2021 with the title Code Red for Healthy Future outlines the growing risk of health and climate. The title of the policy brief is Climate Change, a Threat to Global Health Security. We have just concluded with the COP26 in Glasgow, and we are facing with a disaster that is looming on our planet, which is melting glaciers, melting polar cap, droughts, water shortage, deforestation, floods, tsunamis, and other typhoons. So it is very important that we, as citizens, are conscious about how we have to protect our environment. And the three key parameters which this policy brief is focusing on is premature mortality due to ambient air pollution, number one. Number two, emissions from agricultural production and consumption, and we face that today. And third is detection, preparedness, and response to health emergencies. We have just been going through a huge pandemic which the world has faced, and the major responsibility for that pandemic is the very fact that we have not protected our environment, we have not taken care of our ecology, we have not taken care of our forests, we have not taken care of our nature, and that is what has to be sensitized to not only every citizen, but for every child, not only of India, but for the entire world. And I think this policy brief for India, which is going to address a threat to talk about climate change, a threat to global health security, I'm sure will benefit all policymakers in the government and will ultimately save our planet. wish all the best.
Thank you, sir, for those thought-provoking words. Now it's a great honor to introduce Dr. Marina B. Romanello, the Research Director at Lancet. Dr. Marina has joined us online. So she's trained as a biochemist from the University of Buenos Aires, Argentina, and holds a PhD in biomedical sciences from the University of Cambridge. Her research has focused on studying how environment affects genetic and epigenetic traits. Currently, she is the research director for the Lancet Countdown, tracking progress on health and climate change, where she leads the research collaboration of over 120 researchers and policy experts from around the world. And she's also in charge of the scientific development and refining of the Lancet Countdown's indicators. So I would now like to request her to give us an insight into the 2021 Lancet Countdown on health and climate change. Dr. Marina, I hope you're able to hear us.
Yes, I hear you loud and clear, and I'm trying to share my screen, so if you can just let me know when that goes live and you can see it.
Sure. Yes, I think we can see it now. Yeah. Brilliant.
All right, first and foremost, I wanted to thank you for the very kind invitation of having me here. Having this event at the ICMR is a real honor for us. And I particularly wanted to thank all of the authors and reviewers of the policy brief, which is absolutely fantastic and such an important piece to put health at the center of the climate conversation in India. So thank you so much for this event. It's really an honor. I'm going to walk you a bit through our 2021 report that, as you have already heard, is entitled A Code Red for a Healthy Future. I'm going to show you why it's entitled that. And I'm going to try to highlight a few of the findings for India, which complement a bit what you have already in this policy brief, which obviously in the policy brief you have the main findings. As you know, the Lancet Countdown is a big research collaboration. We nucleate around 43 partners around the world, from main and leading universities to UN agencies. And our family is composed of 120 researchers and scientists that go from the physical sciences, environmental sciences, medical sciences, and humanistic sciences as well. And each year, these researchers come together to produce data to track progress on health and climate change. We produce annual indicators, of which you're seeing the latest one. But this is just the latest of the series of the Lancet Countdown. It's actually the 5th iteration that we have of over 40 indicators where we track the health impacts of climate change up to date, as well as what are the implications of the world's response to climate change, the way we're adapting and we're mitigating to climate change, and the way we're transitioning to a low carbon economy, and what that means for health. So we try to put health at the center of the climate agenda because, as the first series of the Lancet Countdown has shown, climate change is a health issue, is the biggest global health threat of the 21st century, but also tackling climate change is the biggest health opportunity of the 21st century. The 2021 report, as I said, gives a code red for health. And this is because in every one of the indicators in which we're tracking the health impacts of climate change, things are getting worse really rapidly, and they're all flashing red. All corners of the world are affected, but what we're seeing with particular concern is that it's the most vulnerable peoples in every country that are having the biggest burden of climate change. And when we think about climate change, the first thing that comes to mind is obviously increase of temperatures. So one of the things that we track is the extent to which very vulnerable populations, people over 65 years of age, very young children under 1 year of age, are being exposed to heat waves. And heat waves, as you know, are not only very uncomfortable, they're also silent killers. They can really tip people over the edge. They can worsen underlying health conditions, particularly affecting those with heart disease, they can lead to acute kidney failure, and they can be lethal to these very vulnerable groups. So as you can see here, let me just put the pointer. In the two graphs here on the right, exposure to heat waves is increasing very rapidly, particularly since the 2010s roughly. In 2020, we saw in people over 65 years of age, 3 billion more person days of heat wave exposure than in a baseline that just finished about 16 years ago. And as you can see down here, India is not an exception. In India, we're seeing extremes of heat and heat wave exposure increasing very rapidly. So this is a particular concern for its morbidity, its effects on mortality. But it's important to note that extremes of heat also has indirect effects on our health by undermining the social determinants of health. Another thing that we track is the extent to which extreme heat exposure is affecting our capacity to work, particularly for laborers that work outdoors for the most vulnerable groups. We estimate that in 2020, almost 300 billion hours of potential work were lost because of extreme heat exposure. And we estimate that around 1/3 of those occurred in India. If you see here, we've divided countries by Human Development Index group. And the concerning thing is that it's countries with low and medium levels of Human Development Index that are seeing the biggest losses, and particularly seeing those losses occurring in the agricultural sectors. Obviously, those very, very vulnerable workers, which also are the ones that determine our food productivity, which is another concern. In India, we're seeing that 60% of the losses of potential work hours, and this amount to 113 billion hour loss, so 60% of those 113 billion hours were lost in the agricultural sector. And we estimate that if those potential labor hours were actually lost, this would correspond to 3 to 4.5% of India's total GDP. So not only does heat affect our health directly, but also indirectly by undermining our livelihoods, our capacity to work, and the social determinants of health. Another concern that we have is with respect to food security. In this indicator, what we're tracking is the extent to which, because of the rising temperatures, the crop yield potential starts going down. We know that as temperatures go up, crops mature more quickly. And what that means is that when they reach maturity, the size of the seeds are smaller. So they yield lower volumes. What we're seeing here is in the global data, the crop yield potential for maize, winter wheat, spring wheat, and soybeans, and we also have data for rice, is going down around the world. And what you can see here is what this data looks like for India. For India too, we see that all of the crops are reducing their potential, particularly maize, but also rice, soybean, and winter wheat with a bit of fluctuation. So this is particularly concerning, obviously, because we're only looking at one aspect of it that has to do with temperature. But on top of this, we also have an increased incidence of extreme weather events, an increased incidence of extreme floods, and also of extreme droughts, all of which are undermining our capacity to produce food. So terrestrial food security being increasingly put at risk because of climate change. And as temperatures change, as rainfall patterns change and humidity patterns change, so does the environmental suitability for the transmission of climate-sensitive diseases, particularly those diseases that are transmitted by arthropod vectors, but also those transmitted by food, by water, or by air that are very sensitive to the environmental conditions. We have already heard a bit about infectious disease transmission, particularly through mosquitoes. And here what you can see is the change in the environmental suitability for the transmission of dengue. Dengue is a leading cause of serious illness and death in Asian, Latin American countries. And the global incidence continues to increase, reaching an estimated 100 to 400 million infections each year. And globally, we're seeing that because of the environmental conditions, the likelihood of transmission of dengue is increasing by 7% for Albopictus and 13% for Aedes aegypti. This is with respect to a 1950-1954 baseline. And as you can see here is the Americas and the Western Pacific, two regions that are very heavily affected by dengue, where we see the biggest increase in the environmental suitability for its transmission in the latest years. And in this way, we have similar results for every indicator. We see that the hours available for safe physical activity are reducing because of an increasing temperature. So we're losing more and more hours of safe physical activity around the world. We're also seeing that negative sentiment expression online is increasing during heat waves because of the mental health impact of extremes of heat. We're seeing that heat-related mortality is also increasing, the lethality of extreme weather events, marine food security put increasingly at risk, sea level rise starting to affect coastal populations and our water supplies, extreme drought events affecting more and more of the land surface area, and wildfires starting to increase around the world, increasing our exposure and their intensity. And we've seen what happened this year in Greece, in Australia last year, what happens in the States very regularly, and even in Siberia. So all of our indicators are flashing red. However, perhaps the most concerning thing is that even with all of these alarms, the world is still failing to respond at pace, and particularly that we're seeing the same trend that we've seen with COVID-19. With COVID-19, the world's response was not a just response, was not a fast response, and we didn't see the international collaboration we were expecting. We're seeing similar patterns in the response to climate change. The world is failing to deliver a just and equitable response to climate change. We know that rapid decarbonization would lead to direct benefits because it would avoid the worst case scenario of climate change impacts, but it would also deliver immediate benefits to health in terms of the co-benefits of that transition through cleaner air, better diets, more active lifestyles, more livable, better, greener cities. One of the things that is particularly concerning, and I know this will be presented a bit in further detail for India when the policy brief is presented, is that countries are not implementing the national health emergency frameworks at pace. With all of these risks on health, our health systems really need to start preparing to cope with multi-hit scenarios and with increasing health risks. And yet only 75% of global countries report medium to high level of implementation of their national health emergency frameworks mandated under the international health regulations. And what is of particular concern is, as you can see here, that the very high Human Development Index country reach about 90% of implementation. But those with low and medium Human Development Index reach just about 50% of implementation on average. And these are the most vulnerable countries. So which is the most vulnerable countries, the ones that are least prepared to cope with health impacts, exacerbating those inequities? And obviously, we won't be able to adapt ourselves out of climate change unless we heavily start mitigating climate change. The energy system is one of the main contributors to global CO2 emissions, and is one of the key areas where we have the technology to rapidly transition towards a lower carbon system. However, if you look at this black line here, this is the global carbon intensity of the energy system, how much carbon dioxide is emitted per unit of energy produced. And as you can see, it has remained fairly stable since the 70s. At the pace of reduction that we've seen from 2014 to our latest year of data, 2018, it would take us 150 years to fully decarbonize our energy system, the global energy system, which is absolutely incompatible with Paris Agreement goals. And as you can see here, it's the very high Human Development Index country, which today have the luxury of being able to afford those better technologies, decarbonizing their energy systems and enjoying the co-benefits of less fossil fuel burnings. Whereas the medium and high, and well, also the low Human Development Index country groups are still developing their economies based on fossil fuels, increasing the carbon intensity of their energy systems, and therefore increasing air pollution and fossil fuel burning. So I know that this will be presented later on as well, the implications of air pollution, but I just wanted to note that globally, we're estimating around 3.3 million deaths directly attributable to PM2.5 air pollution, the most damaging form of air pollution. 1/3 of those 3.3 deaths, almost 1 million deaths, came directly from fossil fuel burning. And once again, as I said before, the very high Human Development Index country group is being able to enjoy better quality of air with more strict air quality control measures and a faster transition to a lower carbon energy system. Whereas the medium and the high Human Development Index countries are not being able to enjoy those clean airs, are not enjoying the health co-benefits of a fast transition. And one thing worth noting here is that this graph is only presenting ambient air pollution. On top of this, we have the added burden of indoor air pollution from biomass burning in the home that particularly overburdens the low human development index country groups because of that lack of infrastructure and clean energy generation. This will be presented a bit further in the policy brief, but just noting that obviously India has a huge problem of air pollution. We saw Delhi schools closing this week because of air pollution, and coal being a big contributor from power generation because India really relies on coal for their power generation. So a huge problem there, particularly for health. And with all of these health impacts of climate change, obviously, there's a huge cost to society. There's a huge negative externalities, health systems being overburdened, loss of labor capacity and loss of lives. And yet, countries are still subsidizing fossil fuel burning. What you can see in this graph is the total amount of funds that countries are designating towards fossil fuel subsidies, expressed as a proportion of their national health budget. And this is taking into account all subsidies, all taxes, net price of fossil fuels. From the 84 countries that we've reviewed, 77% were still overall subsidizing fossil fuel burning, making it financially attractive to harm people's health through fossil fuels. India subsidizes fossil fuels still, assigning 30% of its total health budget to fossil fuel subsidies. Of course, many people depend on the subsidies today for their livelihoods, for their jobs, but it's important to note that those funds could be redirected towards activities that have added health benefits and direct benefits to people. So there's really a big incompatibility. And we've seen this discussion during the COP, a very, very heated argument around fossil fuel subsidies, but expressed as a percentage of health budget is pretty unacceptable that we're still designating taxpayers' money towards something that harms our health. However, and even with everything that happened during COP, we do know that there's still hope. The energy system is transitioning faster than ever towards renewable energies. We're seeing an annual increase of about 17% in the proportion of total energy that is being generated from new renewables, from solar, wind in particular. And India here doing particularly well, reaching 6.6% of its total electricity production from renewables. When we look at coal, India still has a big reliance on coal, but it's not increasing the share of its energy production coming from coal. So it's really positive that the share of energy produced from renewables is increasing this fast, because this means cleaner air, better quality, and cleaner, more reliable energy sources. And the other thing that we're seeing is that countries are starting more and more to realize what the intersection between climate change and health is. Despite some disappointment during the COP, we are seeing that countries in their UN general debates are starting to mention a bit more the intersection between climate change and health. In 2020, we reached 47% of countries mentioning the interrelationship between climate change and health. Much of this had to do with the COVID pandemic, that's true, but it still brought awareness to the importance of our health being at the center of conversations. India, however, did not mention this interlinkage, and that's particularly notorious given the huge burden of air pollution and of the lack of reliable, clean energy sources in India. So something here also to be said about the extent to which health is being prioritized in the climate change conversation. And with that, I will just close with a reflection that comes very clearly in our report. We're seeing the world trying to recover from the COVID-19 pandemic, and we're seeing countries committing trillions of dollars towards COVID recovery. However, up until now, just 18% of those COVID recovery plans are expected to lead to greenhouse gas emission reduction. Much of them lead towards an increase in greenhouse gas emissions. So overall, we're seeing a negative effect of COVID recovery plans that goes completely against the Paris Agreement and the nationally determined contribution commitments. However, because we have this fast unrolling and this fast reactivation of economies, that really provides an opportunity of redirecting those funds and doing that leapfrogging towards a cleaner, more sustainable energy system. This would lead to economic and environmental sustainability, leading to industry development that is sustainable and can remain in the future. better health and reduced inequities. But as COP has shown, this will only be possible if leaders commit to urgent action and particularly act together to ensure a just transition that leaves no one behind. So with that, I will leave the floor for the discussion to the policy brief. But before doing that, I wanted to invite you to visit lancetcountdown.org, where you can see more of our indicators that are there at a national level with national data for you to explore a bit further. And with that, I'll stop sharing. Thank you so much.
Thank you. Thank you, Dr. Marina. Thank you for the statistics, indeed very alarming and thought-provoking. Thank you. I would now request Professor Arun Sharma to speak on growing evidence to inform policy. Professor Sharma is the director of the National Institute for Implementation Research on Non-Communicable Diseases, one of the regional institutes under ICMR located at Jodhpur. So Dr. Sharma has played a very vital role as a reviewer in providing the necessary critical inputs which have helped shape this policy brief. Professor Sharma sir, I request you to, he's joined us online and he will now be delivering his talk. Thank you.
Good afternoon, distinguished guests, colleagues on the dais, my dear friends from ICMR, Dr. Marina, and all the viewers. It gives me a great pleasure to be part of this all-important event of launch of the policy brief for India 2021. And I have been asked to speak on growing evidence to inform policy. I will use this open-ended statement in two directions. One, I will see it as a passive verb, growing evidence to inform policy. Yes, evidence is definitely growing. And Marina in her presentation has given enough statistics to say that there are evidences which shows the relationship between climate change and health and its detrimental effect. On the other side, I would like to use this open phrase to say we need to be growing evidence to inform policy more substantially so that the actionable points are taken in more detail. So I take that liberty and start talking about two components of it. Climate change per se is a code red for health. There's no doubt about that. But where the gap lies in understanding the exact complex relationship between climate change and its health effects. Because we know that majority of the diseases which are attributable to the climate change and its associated phenomenon are multifactorial in origin, and climate change happens to be only one of the components that contribute to the causation of the disease. That is why there is skepticism in the public health group and in the clinicians to accept the role climate change is playing, especially in the chronic and non-communicable diseases pathogenesis, as well as the magnitude of the problem. Now, to start with, historically, if we look at the data and also to the phenomenon, climate change has been accepted to be anthropogenic in origin. In historical times, when we lived more with the nature, when we had less industrialization, when we had less urbanization and less mechanization, probably the global warming was not a significant factor. But in last 200 years or so, when the mechanization, when the industrialization had started and the urban settlement is growing, the anthropogenic activities are contributing to the global warming. We accept that, and there is no dearth of evidence on that. But this has primarily come from, if we agree, air pollution. And air pollution has 99% been contributed by human activities, whether it is in terms of use of fossil fuel for energy, for vehicle, or for running of the factories, or whatever be the source. And that, along with the agricultural practices, has increased the concentration of carbon dioxide, ozone in the lower layer, paradoxically creating an ozone hole in the stratosphere, but increasing the ozone levels in our respirable atmosphere. And the third is particulate matter pollution. Now, all these three phenomena, if you look evidence-wise, carbon dioxide average concentration in ambient air used to be 350, which was in the healthy range. But now it has increased to 440 in our ambient air. Therefore, the buffer that was available is not there. And hence, now we are living in an atmosphere which is more having concentration of carbon dioxide. Similarly, the ozone concentrations are rising, particularly in urban settlements, and the detrimental effect of ozone in human health, particularly on the nervous system, on the reproductive system, are well documented, and we are worried about that. And finally, the third part, that is the particulate matter, especially of the 2.5 micron dimensions and smaller diameters, which are constantly increasing in concentration. And therefore, these together are providing enough environmental factors to cause global warming and climate change. And the impact has been visible on two dimensions. One, the acute dimension, where we see there's an increase in catastrophic natural disasters happening all around the world. And as a consequence, acute loss of life and disabilities that is resulting from it. And on the and it includes both infectious diseases as well as non-infectious diseases. On the other side, the continuous growing evidence of rising pollution, the global warming, rising temperatures are threatening the very fabric of normal physiological conditions that we are used to living in. And therefore, the changes are manifesting in terms of chronic non-communicable diseases. That is the second biggest challenge. So we can conclude from this particular aspect that we have enough evidence for climate change, enough evidence for air pollution contributing to climate change, and together they are causing health effect on the adverse effect on human health. Having said that, the evidence that Marina presented in her talk was from the global perspective, global level, and quite a bit of it is also based on mathematical models. From the policy point of view, if we look internally and if we look at the Indian scenario, we need to generate more evidence about the health impacts that might be happening to the habitants living in Himalayan zone, the people who are living in close to the coastal areas, and people who are living in the river plains. Now, these three areas are definitely contributing in three different ways to the global warming as well as other climate change effect. And therefore, the health effects are likely to be going different. This is where we lack evidence in terms of substantial data, and that is where we need to grow evidence. So this policy brief definitely is a direction to that we want to look at our agricultural practices. We want to look at our energy generation and energy consumption pattern, which is not homogeneous or uniform all across the country. And finally, the third part, that is the preparedness of health emergency framework. That is, how are we there to cope with the disasters that are happening as a result of climate change? We need to be more prepared, we need to be more proactive, and we need to have very systematic efforts in this direction. So we need to start monitoring health activities, the degrading health of the communities through sustained cohort studies, as well as a continuous monitoring process of the data which is being generated from the hospitals and the health centers. And the data must be available with the scientists and researchers to aggregate and collect the data and correlate this data with the climate change data, which are the other evidence areas that I talked about. And from that, we generate more evidence that how much proportionate contribution is there, going to be there, of climate change and pollution factors on human health in coming times. Thank you very much.
Thank you, Professor Sharma. I'm happy to call upon my colleague, Dr. Liana Susan George, who is the key author of this policy brief. She will be presenting an overview of the rationale behind the policy recommendations.
Very good afternoon, respected DG ICMR, dignitaries on the dais, off the dais, as well as academicians, scientists, and researchers who've joined from across the globe. It is with great pleasure that I present before you the evidence used for the policy brief for India 2021. And this policy brief is titled as Climate Change, a Threat to Global Health Security. In the recent years, the frequency of occurrence of extreme weather events, be it the recent floods in Kerala or Chennai, or the landslide in Himachal Pradesh, or the extreme heat and winter that we face in Delhi. India has been severely affected by the aftermaths of climate change, and evidence has shown that it has a great impact on health, be it direct or indirect. So this is a complex matrix that is shown here, which all of us are very familiar with. The impact of air pollution resulting in asthma and COPD and cardiovascular diseases. But of concern is the emerging vector-borne diseases, the change in the vector biology, resulting in the emergence of, also the re-emergence of new infectious diseases. Another area of importance is the waterborne and water-related diseases occurring as a result of poor water quality. And most importantly, the food insecurity that is happening, resulting in malnutrition and chronic diarrheal diseases. Another important area that I'd like to highlight is the forced migration, that is climate change-induced migration, which is also resulting in civil conflicts and has a major bearing on the mental health of the people. So with this background, I would like to go further. This Lancet policy brief actually looks into three key parameters of prime importance to India. First being premature mortality due to ambient air pollution by sector. Second, emissions from agricultural production and consumption. And the third being detection, preparedness, and response for health emergencies. Now, looking at the first parameter for the day, premature mortality due to ambient air pollution. So as we all agree that air pollution is a prime environmental threat, because it results in premature mortality, morbidity, and also affects economic productivity because sickness absenteeism increases. Because of this, air pollution has been expressed across three different sustainable development goals, being 11, 7, and 3. And particulate matter is, as you all know, is a proxy indicator that we have been using for measuring air pollution because it is one of the major pollutants. And there are two types, particulate matter 10 and 2.5, and these are the different compositions. And this occurs as a result of construction, demolition, burning of fossil fuels, power plants, and emissions from vehicles, etc. Major impact on the health of human beings, because the particulate 10, actually, it penetrates into the lung, and the finer it goes into the bloodstream as well. It is manifested as asthma in children, worsening of lung function in adolescents, COPD, cognitive impairments, and mental dementia in adults. And it also affects premature, results in premature deliveries, low birth weight, etc. Now coming to the data per se. So as per the 2011 Global Lancet Countdown report, if you look at it, in 2019, about more than 907,000 deaths were attributed due to particulate matter 2.5. When compared to 2015, this is an 8% increase in the deaths. So out of these deaths, 17%, that is about 157,000, has occurred as a result of the combustion of coal, mainly in the power plants. If you look at the diagram, you'll see it's mainly in the power plants, followed by the coal combustion in the industrial and to a less amount in the household settings. So when you compare it with 2015 data, this is a 9% increase in the number of deaths related to coal-derived particulate matter. So coal is something that which we cannot live without, and it is a major source of power for us. So however, the revised emission guidelines of 2015 laid by the government states that the power plants should implement pollution control technologies, and we need to achieve this by the year 2022. However, the major barrier in this is because of the cost. An estimated cost for technology for controlling sulfur oxides, nitrogen oxides, and particulate matter would range somewhere between 73,000 crores Indian rupees to 86 crores. So that in turn would increase the cost of electricity generated by coal power plants, would increase somewhere between 9 to 12%. However, the cost cannot be overlooked because the cost must be considered in the wider context of the economic and social costs of treating the health impacts of air pollution. Coming to the second parameter for the day, that is emissions from agricultural production and consumption. So India is a growing economy. The purchasing capacity of people are increasing and there is rapid urbanization. So hence there is an increase in the demand and production of livestock products. So the ruminants such as cattle, sheep, goats, buffalo, they produce good quality meat as well as milk, which are good sources of high quality protein for human beings. And however, these ruminants are one of the major contributors to greenhouse gas emissions such as carbon dioxide, methane, nitrous oxide, which are the byproducts of respiration, enteric fermentation, and manure management, respectively. So of these greenhouse gases of concern are methane and nitrous oxide, which have got the highest global warming potential. So just a little thought into what methane is. Methane is being produced by the rumen or by the fermentation of the feeds. It occurs because of the presence of the microorganism called methanogens that reside in the reticulolumen and the large intestine of these ruminant livestock. So with the help of these microorganisms, fermentation of the plant materials occur in the digestive tract and methane is being produced. And as a result, it gets expelled by the animals. So looking back at the data from the 2021 Global Lancet Countdown, 46% of the agricultural emissions in India are contributed by these ruminants such as goat, sheep, and cattle. And emission intensities, they differ and it is dependent on the feed ration that is being given on multiple factors such as the quality of the feed, digestibility, and the composition. So the impact of the level of enteric methane and the manure emissions per unit of production of milk or meat would differ. And it would vary depending on the commodity. The highest being for beef and the lowest being for cow's milk, chicken products, and pork with less than 100 carbon dioxide equivalents per kilogram of the meat produced. Coming to the third and the last is the detection, preparedness, and response to health emergencies. So all of you would agree with me when I would state that health emergencies occurring as a result of climate change has become a very common phenomenon. And the negative impacts are on water, soil, air, food chain, and it does not respect borders and it crosses borders. And hence, climate change is definitely a global health security issue. And for that, we need to address it by having global partnerships to address these public health emergencies. So as a nation, we need to strengthen our national capacity for disease surveillance, prevention, and control, especially at the points of entry. So that is why we have the International Health Regulation, which has put forward 13 core national capacities, out of which in this indicator number 8, that is National Health Emergency Framework, is what we have been highlighted upon in this policy brief. So as you all know, the National Health Emergency Framework not only looks at public health emergencies and events such as droughts, floods, storms, air pollution, infectious diseases, but it also played a very important role in the recent COVID-19 pandemic, and we were able to spread the control the spread of COVID-19 pandemic to at least a little, thanks to the IHR and the National Health Emergency Framework that we had. However, there are still gaps prevailing, and there's a long way to go. So looking at the 2021 Global Lancet Countdown report, it's a kind of a positive story. Out of 35 countries with the low Human Development Index, of which India is one, India was able to achieve 80% implementation, and we occupy the 7th position along with Morocco and Bhutan. So however, India still has a long way to go before we achieve the complete implementation of the IHR. So way forward, what I would say is both the cause and the solution are in our hands. We need to work together, engage in timely and appropriate people-centric actions for limiting human-induced global warming. We need to work together to limit the cumulative greenhouse gas emissions, reduce it directly, and work towards achieving net zero carbon dioxide emissions by 2050. So I would like to end by quoting the famous words of Ban Ki-moon, former UN Secretary General. We are the first generation to be able to end poverty and the last generation that can take steps to avoid the worst impacts of climate change. Thank you all for your patient listening.
Thank you, Dr. Liana. The last speaker for today is Dr. Samiran Panda, and he heads the Division of Epidemiology and Communicable Diseases at the headquarters here. Dr. Panda is one of the key authors of this policy brief. I call upon him to highlight the policy recommendations for India.
Good afternoon. On the dais on my left, Dr. Liana, Dr. R.S. Haliwal, of course, on the right-hand side of DG ICMR, and I was on his left. That actually describes about an interface. I head ECD division, as Dr. Tanika introduced me, and Dr. R.S. Haliwal heads the non-communicable disease division. And we are talking about something which is about the interface, and climate actually holds these issues together. This division is very artificial, as we have understood from what Liana presented and also from Dr. Marina's presentation. Clearly, we cannot afford to deal with infections first and let us deal with them, handle them properly, and then move on to the non-communicable disease. Well, gone are those days, or gone are those discussions. What are we talking about? While we thought of education of children, there was this saying, which we said, that if mother is educated, the children would never remain uneducated, because an educated mother would always, teach her children or even push them to school, whatever the case may be. If the girl is educated, the girl becomes mother at some point in time, and the children can never remain uneducated. But today, we are talking about health of the mother. If the health of the mother earth is not good, how children, who are all of us, can be healthy? So we are talking about not only this planet, the earth, the water, and the air, because we survive. We draw our nutrition and our life force from there. So that's why it is so very important. Of course, we will go to the policy recommendations, but how does policy recommendation get formed? Is it something carved in stone? No. Data is for action. And data, as Dr. Arun Sharma talked about, keep on getting generated. So when we have more data, maybe we have to relook into the recommendations and again redraft them as appropriate. So the point I'm trying to say is that it's an evolving process, and we won't have answers to all the questions today in this room or on this planet. Even if we assemble together, we won't have all the answers. But the policy recommendations always get formed by incomplete evidence, as the case may be. And then with more data, there will be a necessity of looking into the policy recommendations once again, and maybe again and again, as the scenario changes. So moving on to the recommendation, can I have the next slide, please? Oh, it is there. All right. So today, that's why I'm saying today it is 15th November, but maybe, down the line, there will be a necessity for looking into it once again. Of course, Dr. Liana Susan George, she did talk about the fossil fuel, so I need not to elaborate upon that. But while we were discussing this Saturday night, there is this message from Liana saying, sir, Delhi, school children are not going to go to school, and 2 days, the city is going to have lockdown. Lockdown is the term that we had to take resort to for COVID-19. But you see, we are not talking about COVID-19 here and lockdown. Lockdown is for the situation of the air and the air pollution. So that clearly says why we should talk about it. And then, of course, phasing down gradually, because no change is always very difficult. The change is painful, but change also requires in-depth thinking. So we cannot overnight go to a shift. And India very pragmatically has decided to phase down from the coal as its main source of energy to the other a renewable form of energy, which is less damaging to the mother air. The second policy recommendation, which is again focusing on air pollution. So there, the necessity for a regulatory framework partnering to the control of air pollution at the source of its generation, such as industrial emissions. There were pictures which you saw from Dr. Marina's presentation and also mentioned by Dr. Liana. And how do we also carefully think about the construction, the way we do the constructions? Because any pollution, be it of air, water, and the climate change, from a broader perspective, would not only have an immediate effect, but there will be a distant and intermediate level, even at the intermediate level or time frame effect. I will tell you why. Because there has been, if I'm not wrong, in Puerto Rico, there was this tropical cyclone. But before I go to other different country, as an infectious disease and tropical medicine person, I had to go to Sundarbans area, 18% of which is in India, and the rest is in Bangladesh, World Heritage Site. People used to go there to enjoy the beauty there. And of course, the Royal Bengal tigers and the mangroves, which is fantastic. But then for the first time in my life, I, of course, had this habit from my childhood days to, try grow things at the backyard of my home. And I know how to do that, be it tomato or brinjal or eggplant or even little flowers. I'm sure many of you did that. I never saw, which I saw in Sundarbans, following a tropical cyclone, when the salty water from the ocean got into the sweetwater pond and then also flooded the land around it. And all the trees, I never saw that kind of brinjal or eggplant, trees, which are black. Absolutely, the trees are all there. And you can jolly well figure out that you are not going to see brinjals coming from those trees ever, maybe within the next 3-4 years. Similarly, the fish in the sweetwater pond, all dead. So here we are talking about an effect which is not only directly helping us to see how the diseases happen, but the nutrition. And if the nutrition get hampered, then naturally the vulnerability to diseases increase. So you see, so it's not just a direct effect of cholera happening. Dr. Dhaliwal was very rightly pointing about, the dengue and cholera, but it is not only the infectious diseases, but the nutrition getting very negatively, impacted upon by the climate change, and which increases the vulnerability towards diseases. So that's what I'm trying to point out. So clearly, we have to have a regulatory framework, and just having a regulatory framework is not good enough. We have to have a mechanism to ensure that we are adhering to that framework and the practices are on par. The third policy recommendation is about agricultural emissions, and Dr. Liana again has given you or shared with you the country-specific data and why it is so very important for us to think of greenhouse gases and how could we reduce these emissions in order to have less damaging effect on the environment as a whole. You'll remember, I'm sure, many of you, that while we were grappling with this COVID-19, we also started talking about One Health. And when we talk about One Health, it's not about human health or animal health, it's about environment of the ecosystem where we live in. So it's all the more important for ICMR to talk about it, because ICMR, due to its experience of working with COVID-19, has really attained a height where the issues when talked about and the data when used for action get amplified because of the work that we have been able to do, and India as a country has been able to do, and the world applauds the steps that India has been able to take, and ICMR has played its own role there. Lastly, it is the framework, and there are 13 core capacities, and of course, Dr. Liana has talked about it, and the 8th one is about national health emergency, and how do we manage them? We are talking about emergencies, but what are the emergencies? I remember that there was this tropical cyclone Aila, and in the introduction, I wrote that India, experiences 7 major natural calamities every year, but the number is increasing. The storms are much more powerful. The sea level is rising. So the calamities that we had recorded are actually not only increasing in frequency, but also in their intensity. And with those increased intensity, the Mother Earth is severely damaged. And then naturally, we are damaged as well. So we have to take care of our mother in order to be nourished by our mother. And our mother then would be only able to take care or good care of us. So how do we invest further in the preparedness in terms of infrastructure, human resources, and the health system capacities? But when we say human resources, the engagement of the community is so very important. Because I was listening to, because Leona told me, sir, is it going to happen on the 15th? We have this launch and Delhi is closing down. And I said, no, we will move ahead because that's the crisis and we have to survive this crisis. So we have to recognize, we have to move ahead, we have to join hands together and plan so that we can do something about it. So the question does not arrive not to have this event today. Why am I talking about community engagement? I was actually listening to a farmer from Punjab. I have got this opportunity of working in different parts of India, Punjab being one of them. And the farmer was talking about how different religion looked into the environment. And the religious leaders have talked about not to harm the earth, be it stubble burning or not to damage water. I mean, that's the term which has been used, and that farmer was talking about it. So you see, it has been in India since long to consider Basundhara as our mother and the environment where we live in. So it's so very dovetailed in our culture and in our belief system. So it should be possible for us to figure out ways so that we sort of protect not only our health, but of the next generation by addressing this. I will end by saying something, but before that, we are now trying to recover from COVID-19. So the importance is to have the recovery plan from COVID-19, not to consider this whole climate change issue will be disastrous, because then we are, maybe it is not COVID-19, but it's disease X. And there is a term, even though there is a WHO document, the document clearly says there is a disease X, and how do you remain prepared for it? So the recovery plan from COVID-19 need to very implicitly accommodate the plan for reducing or mitigating the change that has already happened and the solutions that we already have. And then also there is a need for some more breakthrough solutions, because it is not enough. Because the climate change has undone many development issues. I was talking about Puerto Rico, but if you go to Sundarbans and in other parts of India as well, due to the natural calamities and the disasters, the development that was achieved, that was undone. And the whole places went 20 years back, 30 years back. So what I'm trying to say is that it is not only about the immediate disease. It is not only about the nutrition that is going to be negatively impacted upon, but also the whole development is going back. So it's almost like, trying to go to the top of that, oil smeared rod, but we are failing. We are coming, the first minute we go 2 meters up, and then the next minute we are coming down. So that's exactly what is going to happen. And that is directly impacting upon the development. So I will end by saying that if we don't do anything, so that's inaction. So we might think that, well, if we don't do anything, we are not spending much money, but the cost of inaction will be huge in future than the cost of action, which we can take now. So let us all have a resolve together, all the ICMR institutes, along with the Ministry of Health and Family Welfare Development, because it is not just a health issue. So let us think of the action, which might appear costly now, but it will actually be much more cost saving compared to what the inaction cost could be 10 years or 20 years or 30 years down the line. Thank you.
Thank you, sir, for giving us some food for thought. So that brings us to the end of this event. Once again, on behalf of ICMR, I would take the opportunity to thank all the dignitaries, directors, the Lancet team, and all my colleagues who have joined here. as well as those who have connected to us through Zoom, for this being with us and sparing your valuable time for this special event. Finally, before we end the program, I will call upon Dr. Liana to give the vote of thanks.
Thank you, Dr. Tanika. You've actually done my work. And it's already past time, but I'm just taking quickly two minutes. First of all, I'd like to thank Professor Dr. Balram Bhargav, sir, without whose guidance and support this Lancet the policy document would not have materialized. So thank you, sir, so much. And also for sparing your valuable time to be here to launch the policy and share your thoughts. I also thank Dr. R.S. Dalwal, sir, who has been very, very supportive for a young scientist who recently joined. So, sir was guiding me how to conduct and organize this event. And thank you, sir, for delivering the welcome address. I would also like to thank Dr. Marina. She is the lead author for the report as well as the research director. So in the last few months, while we were finalizing the Lancet paper, she actually chipped in at the last minute and edited the entire version for us. So thank you, Dr. Marina. She, along with Dr. Anthony Costello, who is the executive director for Lancet Countdown. So there was a last minute COVID crisis, but however, the team stood together and they were very much adamant that they, along with different countries, are putting forward the policy brief. So India should also come on time. So ours launched along with the global report on time, but this is the official launch for India. So thank you both. And I have to especially thank Francis McGuire, who's been working with me for the past 6 months while deciding on which indicators that India needs to focus on and how to write it up. And Dr. Alice is the one who actually introduced me to her, and Dr. Kim, who's a Lancet Countdown consultant, who is broadcasting this launch over the world. So I thank the Lancet team for the inputs. Now I take a special vote of thanks to my co-author, my head of the department, Dr. Samiram Pandasa. So his expertise actually improved the quality of the document and repeated corrections one after the other. But I think at the end, it was worth the effort. So I learned a lot during the process. And Dr. Arun Sharma, sir, at the last minute, he was very good enough to chip in and review the document, even though we were under a lot of time pressure. Sir actually did a fantastic job of reviewing it and highlighting certain things that we, it missed our eyes. So also, I would like to especially thank all the senior scientists who are here today and the team at ICMR. I've just joined here like 6 months back, and the team has been wonderful. Especially, I need to put in certain names here because when you're new and you don't know how the process goes around, certain people have really gone out of their way to help me. Dr. Lokesh Sharma, sir, Dr. Rajnikant, sir, Dr. Harpreet Singh. They've all, and the IT team, especially Yogesh and Sanjay and all, who've been actually helping us to actually materialize this launch event. So a big thank you to you all. I also thank all the audiences there are academicians, scientists from all the other ICMR institutes, and also students have joined. So thank you all for joining in. I hope it was a very useful session for the students as well. And I also take this opportunity to thank my CSTP unit colleagues who've been my pillar of strength. And also last but not the least, Dr. Tanika for being the wonderful MC that she is. Thank you all so much.